This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Would you talk about what would disqualify a potential sperm donor?
Okay, so let's talk about sperm donation and what we do to make sure that the sperm that we get is going to be safe and likely to produce a pregnancy for the recipient mother or future mother. So when a donor comes in to see us and says, I want to be a donor, the first thing we do obviously is to check that he's got sperm. And assuming that he has any sperm, it is possible for us to be using him as a donor. It doesn't mean, even with a low sperm count, because we mostly do IVF, and we can use 60 and use that sperm even if he has a lower sperm count. Someone who gets no sperm is obviously going to be excluded. There's no sense in that. So then what we do is do a series of blood tests to exclude infections that might be transmitted by the sperm to the recipient. So we look for HIV, Hep B, Hep C, and we make sure that they're all negative. And indeed, we repeat those tests at least 3 months after the donation has happened, because it's not out of the question that a male was actually affected by one of these diseases at the time of the donation, but the blood test hadn't picked it up because the immune system hadn't recognized that there was something there. So we check in 3 months' time to make sure there's no positivities. The next thing we do to make sure that the donor is suitable is to do genetic testing. And what we are doing is looking at their basic, called karyotype, that's the number of chromosomes they've got, make sure that's normal. And then we also do what is called extended genetic mutation screening. So that's looking for things that don't necessarily affect the donor, because the change in the genetic makeup is only happening in one of the 2 chromosomes. But if that mutation also was present in the recipient's chromosome makeup, the 2 coming together may end up with a genetic disease in the child. So the first thing that we do is these genetic testing on the donor. And then if a woman chooses that donor, even if he has that mutation, we can test her to make sure she's not carrying a pair and therefore avoid the possibility of an abnormal child. So we're very careful about that to make sure that the recipient is not at risk of having a baby with an abnormality. It's not 100%, but it's certainly a lot further than it was even 5 years ago. We wouldn't exclude a donor if they have that mutation. It just means that the woman will have to have extra testing before she receives that sperm or decides to receive that sperm. We look at the psychological makeup of the donor. That we do counselling, ask about past history of mental disease, and we have excluded men who have schizophrenia because we know that can be a hereditary thing. And even if a man has HIV or has had in the past, we won't necessarily exclude them, but necessarily exclude a man who has had HIV, but the woman is informed that he has, but the testing will make sure that he's not active at the time, and therefore will.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.